The first of which is, what exactly is infertility and how common is it, in couples?
Basically, when we're talking about the infertility, if you go with the definition, those who cannot conceive for 1 year, having said that, having the relationship properly.
Tell me, what are the primary causes of infertility?
The cause, if you divide into the male and females, if you're thinking of first is a sedentary lifestyle, the obesity is increasing.
Correct.
Secondly, the long distance relationships are there. And late marriages, because if you are going to get married at 42 or 40, your reproductive capacity is going down, and you need to understand, because the IVF has its own limitations. We are making the babies and we are putting the babies inside the uterus,
Right.
but ऊपर वाले ने वो खुद ब खुद बढ़ना चाहिए, so that is a natural way.
तो बेसिकली आप नेचर के साथ एक लिमिट तक
कर सकते
खेल सकते हैं, but उसके
उसके बाद-
beyond what is natural and what is in God's hands is
Yeah, absolutely.
wow. Coming that from a doctor is very refreshing कि दवा के साथ साथ दुआ की भी जरूरत
की
होती है. क्या बात है. Hi, this is RJ Tia, and today we have a very special BSV Pharma doctor visit. And with me is Dr. Ashish Kale. He is MBBS and infertility specialist from Pune, a leading expert in reproductive health and infertility treatment. Dr. Ashish Kale is here to share valuable insights and answer all the questions that you might have related to infertility. Thank you so much for coming in the studio, joining us on the show. How are you,
Thank you.
Dr. Ashish?
It's being a pleasure being with you and sharing some experience related to infertility.
Superb. So, of course, there are so many questions, that I have on my mind related to infertility, and so many questions that my listeners often keep sending.
Yeah.
The first of which is, what exactly is infertility and how common is it, in couples?
Basically, when we're talking about the infertility, if you go with the definition, those who cannot conceive for 1 year, having said that, having the relationship properly, they will not conceive, then it causes a infertility. But nowadays, if you ask me, how much is the incidence of infertility?
Right.
So if it depends upon the age group, as well as the women are now equal to the men, so they have their own conscious decision when to get married.
Correct.
So if you are going to get married little bit at a later date, so the chances of you having this problem will be higher as
Right.
compared to the younger patients.
Right.
And secondly, the incidence same. If you are asking me, if the incidence is same between the male and female both, so it's not the question that the only male has a bigger problems and not the females. So we have the mixed population wherein the male and female are
both
same.
have the problems, and it is quite common now because
Quite common, and because of the, thank God to the social media, everyone talks about the infertility.
Yes.
The awareness of the infertility is there, so the treatment options are available.
Yes.
So
Because as you said, now because of social media, there's a lot of conversation that's happening. There's a dialogue that's being exchanged amongst couples, of all ages. Because earlier people were super confused because they thought, it's not as common as it is now, and they would not talk about it, and they would suffer alone. Whereas now people talk about it openly, and and therefore there is a lot of help that's being kind of exchanged.
basically, what we thought of 10 years down and now, thanks to social media, thanks to this awareness campaigns by different pharmaceutical industries, as well as the couples. And when you are talking about the awareness, it's a Google is the best way. You can just Google it, you will find it out. If you have the irregular menstruation, then you Google it, you will find out the answers for it.
Correct.
Similarly, if you are staying together for 1 year and nothing is happening, you don't have the babies, then again it's worrisome for the couples, and they search the Google reviews, they come back to the doctors, and it's the story to begin.
Right. But tell me, what are the primary causes of infertility, both in men and women? You said age is definitely one factor because couples are opting to get married at a later age now. Besides that, what else do you think is the cause?
The cause, if you divide into the male and females, if you're thinking of first is a sedentary lifestyle, the obesity is increasing.
Correct.
Secondly, the long distance relationships are there. And late marriages, because if you are going to get married at 42 or 40, your reproductive capacity is going down anyway.
Correct.
Secondly, the what you call as habits. We as a teenagers, you can see the consumptions of alcohol, smoking is rampantly there.
Right.
And that causes a ill effect on the reproductive age
Right.
and reproductive factors.
Right.
Third, as far as the males are considered, there are myths about it. Some they started taking the medicines without consulting the doctors in early age, reproductive age group, in order to increase their stamina or something like that, and that usually causes the side effects to them. And then it's a major thing that they have erectile dysfunctions, they have premature ejaculations, they have not sustained the what you call as erections. So all these things matters to them, and then it is one of the cause of infertility. For females, the first consider is a polycystic ovaries. Nowadays we have the females with the different eating pattern.
Right.
So they eat usually outside home rather than inside, and that causes the obesity. That will causes a PCOS, irregular menstruation, not going to have a normal ovulation periods, and that's the
So diet plays a very important role here.
Yeah.
So I think as parents of young or growing girls, I think it's very important that we inculcate, those habits that that children eat more at home. Is that also for males?
Males, see, when you are as a mother of a son, usually she talked about beta aap khalo, khalo, and that khalo will becomes a obese boy, and that
Right.
obesity will hamper him
Right.
for the
Right.
future things.
Right.
So it is better to have a appropriate diet, a good exercise, and away from the social drinking and alcohol and all that things.
Correct.
Yeah.
So what are the treatments available? What are the options available? Because people who go through infertility, I have seen often are super confused. They try all the ways possible. They go to zillion hospitals. They visit various doctors in different countries. What are the kind of treatments that are tried and tested that exist?
Nice question, Ria. First of all, the treatment options is depending upon the age of the couple. You cannot just do all the tests for the females and the male is remain behind. No, it has to be a investigation as a couple.
Okay.
Secondly, is what is lagging in what. I've seen the many young girls having their ovarian capacity very less. So for that time, the time is not in your hand.
Right.
So you have to utilize those timing and utilize the treatment options. You can have a planned relationship, but that particular days are important in your life.
Correct.
If you're not meeting on those particular days, then how the pregnancy will happen?
Correct.
Similarly, the IUI, that is called as intrauterine insemination. Those are the factors where the male factors is responsible. If the semen reports are not normal, there is a motility is not good, then IUI plays the important role for the treatment options.
Correct.
And if said and done, there is a poor ovarian reserve, आपके अंडे बनाने की क्षमता कम है, and then semen is normal, but in that case we have to utilize each and every egg of that female in order to conceive her and in order to deliver the baby for her.
Okay.
So that is the option where is the IVF plays a role.
Okay.
What you rightly asked, they come out goes to each and every one. So they go to the different clinics, they go to the different countries. See, it's not the question of marketing, it's the question of your take home baby rate. And in the world, I will be very categorically saying it, in the world, the take home baby rate is 30 to 40%.
Only.
Oh. Those IVF center claiming that they are having a 80% and 70% and all that gimmicks, please don't follow all that.
Okay.
That is the real request from my side. Because that is the things that you need to understand, because the IVF has its own limitations. We are making the babies and we are putting the babies inside the uterus.
Right.
But ऊपर वाले ने वो खुद ब खुद बढ़ना चाहिए. So that is a natural way.
तो basically आप nature के साथ एक limit तक
कर सकते हो,
खेल सकते हैं, but उसके beyond what is natural and what is in God's hands is.
Yeah, absolutely.
Wow. Well, coming that from a doctor is very refreshing कि दवा के साथ साथ दुआ की भी जरूरत होती है. क्या बात है. अच्छा, can you explain the process of in vitro fertilization, IVF basically, in simple words? What is ART?
Okay, IVF is very simple. Nowadays, gone are the days where the female is afraid of taking more injections. It is a planned procedure.
Right.
You can plan your IVF cycles. There is nothing called as unplanned cycles.
Okay.
So the lady has to take the injections depending upon her scan on day 2.
Okay.
Depending upon the blood levels of the AMH. Okay. That is called as anti-Mullerian hormone, which will tell us the capacity of her to produce the eggs.
Okay.
And that will start from day 2 of her cycle she has to take 10 to 11 injections. Once your eggs going to get mature, under the sedation or under the small anesthesia, from the natural opening, that is a vagina, the eggs are going to get retrieved. So she's not undergoing any type of surgery.
Okay.
And the male partner has to give a semen sample.
Okay.
And that male and gamete and the female gamete is going to get interactions, that is called as fertilization, takes place in the lab. And there are the cells.
Okay.
We talked about babies. Test tube babies is not the babies. They are the cells. From that cells, the individual thing will happen.
Okay.
So it's just a 64 cells at the day 5 embryo transfer, what we call.
Okay.
And day 3 is 6 to 8 cells. So these 8 cells and these 64 cells turn into a baby later on. And that's why we put the things into the uterus or into the womb of the lady, and with the natural process it will grow.
Okay. And till what age does IVF work?
Yeah, that is again the very good question, because there are the guidelines from our ART registry.
Okay.
That who can avail these services. At the age of 50, 55, you cannot.
Okay.
So the male should be less than 45 and the female should be less the same age can avail these services.
Around 45.
Around 45. And that to be, if she is having her own gametes, it's fine. Otherwise, you have to go with the gamete banks. That is called as a oocyte banking, where the eggs are being stored.
Okay.
And you can take the eggs, make your what you call as a dream come true. But that is from like what we get the blood from the blood bank. Similarly, we have the gametes bank.
Okay.
Like from where we take the semen sample, if the male doesn't have the semen sample.
Okay.
And same things, we get the eggs also from the bank.
Oh.
And make the babies.
Okay.
So it is like a making the babies, but they are not genetically your child, because that obviously the eggs are coming from the different
somebody else.
Somebody else. But your husband has his own contribution to that.
Okay.
So that is called as ART bank.
Okay.
In Pune, we do have.
Very interesting. Okay, are there any lifestyle changes that can improve fertility? And as you said, diet plays a very important role. So what are the things that can increase the chances of success with IVF? Because IVF also, as you said, is just 30 to 40%.
Yeah.
What can help, make the chances
all,
better?
You should not be stressed about, because it's a long journey.
Right.
And the money is there.
Right.
You are put on your money, your health, your so automatically you are going to have some stress at your back of your mind.
Right.
That your husband has put so much of money into the treatment, and the treatment has to get successful.
And also women go through also a lot. It's painful.
There is a painful injections you gone through.
Yeah.
There is a mental pressure from the family members.
Right.
To get her things done.
Correct.
So all that things. So you should be stress free. Then you need to have a balanced diet.
Correct.
You need to have an appropriate sleep. So that are the key success things. And please, you ask. There is a power of asking. You need to ask your doctor, how many babies are you going to put? What are the grades of those babies?
Right.
Whether what is my probable chance of coming in that 40%?
Right.
So all that things you need to
discuss.
Ask first.
Okay. So as you said, there's a lot of stress that, people come with, and it's very natural, as you said, so many factors. There's peer pressure, there's money involved, there's pain, there's stress, and you don't want to go through that again and again. There's so much that happens. So can you elaborate on the emotional and psychological aspects that, not just the woman, but as a couple, somebody who's opting for this infertility treatment might go through?
I think emotional stability, even if I talk 1,000 times, it doesn't make any difference as far as you are into that situation. The person who is in that situation makes a difference whether you can handle that kind of a stress. And stress has always been there. Because once you are gone with the 15 days, you are going to do a urine pregnancy test. Your hands are going to shake, and whether it is come positive or negative.
Very true.
So that stability, you required a family support and the support from your husband or maybe wife. So that is the things that you as a family, you have to face that particular situation. And mind well, there is always that if you have extra babies, that can be cryopreserved. So failure is not the end of the day.
Right.
You do have your babies, you can put that babies again.
Correct.
To come into that 40% again and again.
Correct.
So that is the cumulative success rate. So if you ask me, cumulative success rate in IVF success is a 70%. That is, if I suppose I done a first cycle, I failed. Second cycle, I may get pregnancy. So your cumulative success rate increases.
Correct, correct.
And that's the stress. If you ask me, I think yoga is the best thing to do.
Right.
If you are happy in doing some exercise, you can do. And you can, if you are happy in talking to your girl as a friend, correct, or your colleagues, it is better that you can
always
talk.
like talk it out. Yeah. So, doctor, tell me, what is the kind of pressure the doctor goes through? I want to ask this. As you said,
Yes.
I'm sure because you must be seeing so much of pressure and the stress in the like on the couple's mind, and somewhere do you feel responsible that I have to kind of help them achieve what they're looking for, and when it doesn't happen, when it fails, what is your reaction and what do you as a doctor go through?
I will be truthful to you. If you can see my calendar, it's a calendar with a work planner. Every day there is a red mark saying that how many patients are going to do their urine pregnancy test and beta HCG. I'm not remembering my own wife's UPT positive, but I do remember the patient's UPT coming positive
Well,
or
that's
negative.
nice, yeah.
And really, when it comes to 3 times,
Yeah.
I'm doing a treatment for third time on the same patient. I don't want the failure on my side.
That's what I'm asking. I mean,
So that's that day is the day. And once it comes positive, I myself go to the Ganpati and said, "Yeah, Bhagwan, it's happening."
yeah,
You should be modest.
right,
That
right.
is the only thing, and you need to be work on it. You have to give 100%, then everything will play their
So
role.
tell me, how does male infertility factor into the decision-making process for IVF treatment? Of course, you've shared a lot of insights, but how does that actually um, matter? Because I'm sure there are a lot of people watching us, and generally, इसका ये जो सारा जिम्मा होता है, ये generally it's put on women.
Yeah.
But I want to understand, how does male infertility factor,
Yes.
come into decision making?
I can tell you right away what is the incidence of male infertility is 30%. So the 30% populations of infertility couples has a male problem.
Okay.
So it means that there is definitely that subset of patients are going to have the problem. If you are not evaluating them, then you are missing your diagnosis. And males, as you said, they are reluctant to undergo any type of injections or any type of treatment.
Yeah.
So the first thing is that you need to be comfortable as a doctor. They talk to me because being a male gynecologist is very easy to talk to the male to male talk.
Right, right.
And then come down to certain things. They usually talk to me even if they're not going to talk to their friends.
Okay.
So that is the great asset.
Okay.
Secondly, azoospermia. Say they give the semen sample and there is no sperm. So if that report comes to them, it's a shocking news. If there is no sperm, what is there?
Yeah.
So the technology has come down. You can retrieve the sperm from the testicles.
Okay.
And you can become a father of a child. But that needs to be given assurance to that patient. So that is the real good things which is happening in medical fraternity.
Okay.
Yeah.
So are there any ongoing research, like you just mentioned, or advancements in the field of infertility treatment that probably people don't know and listeners should be and viewers should be aware of?
AI is coming up everywhere.
Yeah.
Your of Instagram, Facebook, AI is.
I had a guest before you when we were only talking about AI today.
Okay, yeah. So the AI coming in infertility patients also. What we are doing is a embryoscope.
Okay.
With the AI technology.
Okay.
If I can get that embryoscope with the AI, I can select the best embryos according to the AI. Just it will capture the image. The image goes to the AI. They find out what is the best embryos for that particular patient. They select the embryos and we do the embryo transfer.
Okay. Okay.
And that will gives us a good pregnancy rates.
Okay.
That is the first thing which is coming up. Secondly, we do a NGS.
Okay.
That is a non-invasive genetic screening.
Okay.
What is the importance of genetic screening? If you are 40 years and above or 35 years and above, the chances of mental abnormalities and physical abnormalities in the babies are higher.
Oh.
So if I'm making the babies, I should be very much assured that the baby will not have this kind of problem.
Okay.
So we'll take some fluid from the culture media that is called as non-invasive gestational genetic screening.
Okay.
And that genetic, if there is a genetic abnormalities, we're not going to put that baby inside.
Okay. Okay.
So
that you get to know prior.
Wow,
which is amazing.
That is a real good thing for that couple.
Of course.
Of having a good, mentally
baby.
healthy baby.
Absolutely.
So that is the second invention. Third is nowadays we are doing is called as a laser hatching. wherein if the thickening of the some cells are higher, we make it a laser hatching, so that the implantation, the embryos are going to get anchored to the endometrium, that is the inner wall of your uterus. So if that is, I just break some abrasions there, it will go and stuck very well.
Okay.
So it will not cause abortions.
Okay.
And third is nowadays there is a research which is called as a third parenting, or what called as a three parenting. If you are having some genetic abnormalities, there is a called as Casper gene,
Okay.
which has to be inserted into the embryos, and that will take care of that genetic abnormalities.
Oh.
If you are having a night blindness,
Okay.
or
Okay.
if you have a vitiligo, white spots on the skin, and you don't want your
Child
to have that, or you are having a breast cancer, you don't want the child to have the breast cancer, even if, because the breast
chances
cancer
of it
chances
basically.
are higher. So the CRISPR genes gives a modification of that genes,
Okay.
and your daughter will not have the breast cancer. So that is a something which is coming up with the good efforts of the scientists.
Wow, that is amazing.
That is what we are looking at. Maybe
Super.
in a year or so, in a city of Pune also we'll have.
Could you again tell me how does that work? Like
That is called as a genetic modulation.
okay.
If I'm putting, if I'm a positive for some gene, and which is going from one generation to another generation. So if I'm having a night blindness, it is because of some genes.
Correct.
It will go to the my next generation.
Correct.
I don't want that to go. Then with the CRISPR technology, I will change that things.
Acha.
And my next generation will not have that genetic abnormality.
So ye, if somebody is going through infertility treatment, only then this is possible.
Or otherwise, if they have a पीढ़ी से पीढ़ी ये
कि कोई प्रॉब्लम होती है,
है, तो वो लोग आएंगे तो उनका आईवीएफ क्यों करेंगे हम लोग, क्योंकि ये नहीं आना चाहिए.
वाह, ये तो बहुत एडवांसमेंट है.
So that is the things that you don't
क्योंकि
want.
कितनी सारी बीमारियां ऐसी हैं जो
जनरेशन से
चली आ रही है और उसको ब्रेक करना बहुत इंपॉर्टेंट है. सुपर्ब. Okay, now what advice would you give to individuals or couples who are just starting their journey, or their the procedure of IVF, or who are even contemplating?
I can tell you nowadays people are doing a pre-conceptional every test. You go to the Hinjawadi, you go to any part of Pune where there is IT crowds are more. They do all the tests before they're thinking that they should become a parents.
Right.
That is a good thing.
Yeah.
Because they will know what my semen parameters is, what is my partner's AMH is,
Right.
what is their AFC.
Right.
So that is gives them an idea about how much time they will take to have the baby. If you have something abnormality in yourself, better to treat it rather than waiting for 5 years, 6 years just to have a natural conception.
Correct.
So it means that whenever you are thinking of reproductive health, it needs to be checked.
Okay.
And it needs to be checked, like आप vitamin B12 करते हो,
Correct.
vitamin D करते हो,
Correct.
आप hemoglobin करते हो, तो ये क्यों नहीं करते?
Right.
So if you are wanted to have a healthy generation, better to do it na. It doesn't cost much.
Superb. Now,
So
of course, now when science has advanced so much, you might as well take the advantage of it. Okay, I was reading about this. What is cryopreservation? Did I?
Okay, yeah.
Was that correct?
No. It's a very much correct. The cryopreservation, पहले दूध वाले भैया वो किटली लेके आते थे, उसमें दूध आता था. वैसे हमारे पास बड़े बड़े टैंक रहते, wherein there is a liquid nitrogen.
Okay.
So what is the liquid nitrogen causes? Liquid nitrogen cause you have some cells which can be exactly preserved to that particular gestation. If I'm preserving the semen sample, and that particular fellow is in army, it goes to serve our nation, and something happened to him, I can utilize his semen cryopreserved sample for make that girl pregnant and having their own dream come true.
Wow.
Similarly, if you are having the girl who is going for the unfortunately diagnosed with the cancer, and she's going for the chemotherapy or radiotherapy, these chemotherapeutic drugs or radiotherapeutic drugs causing a ill effects on their gametes, so they can store their eggs.
Okay.
The celebrity is Diana Hayden. She has stored her eggs, and after 40 years or 43 years, she has that the same age of 23 एज ऑफ देयर अंडा का एज 23 था, लेकिन वो will be a 43. Correct. And you have a beautiful babies. Wow. So you can cryopreserve your gametes, you can cryopreserve your embryos. बच्चे भी आप रख सकते हो. समझो आप फर्स्ट आईवीएफ के बाद आपको बच्चा रह गया और आप चाहते कि 3 साल के बाद मुझे बच्चा रहे, तो you can cryopreserve your babies and you can after 3 years you can have the same babies again. Oh. So that is called as a cryopreservation. You can freeze the life. Okay. Super. And you can make that happen again. Wow.
And what is FET?
Oh, yeah. So this is the continuation of this journey. If I'm preserving my embryos, that means my babies are being stored, and I wanted to get a pregnancy again. So we'll just make the अंदर का endometrium preparation,
Okay.
जिसको वर्क बोलते हैं, वो हम लोग prepare करेंगे, and then we'll just put the baby inside. So that is called as FET.
Okay.
So there is no need of you undergoing a injection course to make
Right.
the eggs, to
Right.
make the again the babies, or
Right.
the male need not to be given a sample.
Hmm.
So already babies are there.
Hmm.
So you just make the endometrium preparation and put the baby inside.
Okay.
So that is a FET.
Super.
And the success rate of FETs are very, very high. Because you don't have everything is under your control. Your hormones are under your control. So the chances of pregnancy is better.
Okay, superb. Okay, you did throw a little light upon, the till what age can you get IVF done? But are there any restrictions or guidelines in particular regarding age or health conditions for someone to undergo IVF?
If you can see, just a few months back, Sidhu Moosewala.
Parents had
done
a baby,
that. We don't want, because see, I'm the person who is in the national body of our association of ISAR.
Right.
I'm a treasurer there.
Right.
Thinking that if you're not having the restriction on the age, and at 50, 55, if you're going to have a child, which is only a 9 months old, when you are turning a 60, that child will be 5 years and you will be no more.
Right, right.
And that's why our association and there are the guidelines by the Ministry of Health.
Okay.
Wherein after that age, you cannot able to have the child, because the liability of the child will be a problem.
Okay.
And that's the reason at an advanced stage, because advanced stage comes with the diabetes, hypertension also.
Correct.
So again, that baby will, even if you are healthy, you are looking healthy,
but
if you are having something else, you are having a diabetes, so that will cause a ill effect on the health of the baby.
Correct.
So unnecessarily burden on that particular family.
Correct.
To start with.
Right.
So that is the whole motto.
Super. Thank you so much, Doctor. You actually, threw light upon this topic, which is very common now. And thankfully, people are talking about it and people are addressing, their concerns about it. And I'm sure after this chat, people will have more clarity on infertility treatment.
I just lastly, I wanted to talk to everyone that please be optimistic in life, because if your one IVF failed, you can always have a cumulative success of having the pregnancy, and you can become a mother.
Wow.
And for the mothers is a God has given that things only for certain people, and you can be one of them.
Super.
And if you don't have anything, just contact us here. We are there to help anyone. So
lovely.
I want the people to come up and share their experiences, come back to us. We are there to support them. Thank you. All
right, so that was Dr. Ashish Kale, and this was a very, very insightful chat here on Fever 94.3. I'm RJ Tia. Thank you for watching.